summer reading done or buying those back-to-school supplies, although that's a big part of it too. Your yearly visit to your pediatrician, another important part of the back-to-school season. Your child's school will likely ask for those shot records as they go to school. Several shots that Colorado does require. We got Dr. Kristen Woodward, our buddy here from the American Academy of Pediatrics, to talk about immunizations with kids. Are there some in Colorado that are non-negotiable? Because I know sometimes you can turn them down. What's the deal here?
So there are shots that are recommended when we think about kids going to school. They need shots going at kindergarten, so between 4 and 6, middle school, and then when they go up to college, they need the meningitis shot. Now, there are exemptions allowed in Colorado. There's some religious beliefs as well as medical exemptions and even personal exemptions. But if you're entering a public school, you do need that shot record. For kids going to kindergarten, this is probably the hardest. We were talking about this, the hardest appointment. They need 4 shots. They need a polio vaccine. They need a chickenpox vaccine, a combination vaccine, which is measles, mumps, and rubella, and then the tetanus, which also has diphtheria and pertussis.
Well, and kids love shots.
Oh, they love them, right?
and you know, they don't. No. I know because I have a kid who just really flips out. Or at least used to flip out when getting shots. And the cool thing is y'all have figured out some ways to at least hopefully ease that stress.
Absolutely. And you know, it's an uncomfortable thing because they're so worried about the shot that you lose that opportunity to have that good interaction. We know that going to the doctor, the well child care visit's one of the most important.
It should be a good experience.
It should be a good experience, and they're so apprehensive and anxious about the vaccine. So there are some things you can do. You know, in that middle school, they need 3 shots. That's still another tough visit. So there are some things that we recommend. Okay.
So you got some things here that will maybe help.
Right. So the biggest thing is distraction. So distraction techniques, whatever that is for your child. So if older kids music, younger kids reading books. We have these pretty cool vibrator toys which you can put on the shoulder.
Yeah, well, it's a combination. It vibrates, but it also has a little freezer pack that goes along with it, right?
So you turn it on and you put it on like 60 seconds.
So you put it like right here, basically?
Put it right there on the deltoid, because that's where we give the shots in kids older than 4.
Okay.
Put it on for about 60 seconds. It's got a cold pack as well. And then before they give the shot, you just move it up, and it should distract the child. It has been shown to be pretty effective.
That's cool. And so some doctors' offices have these.
Yes.
You can buy them as well.
You can buy them too online.
Awesome.
Certainly a cold pack. And then in Canada, you know, they're really using topical anesthetics to help decrease the shot pain, and we're seeing that more here too. Now, you want to talk to your pediatrician. It does require a prescription. It's not always covered by insurance.
Is that what this is right here?
It is. It's a combination local anesthetic. We use it all the time in like the operating room for kids who get IVs, but we're starting to use it more with immunizations. It does numb up the skin. Again, it doesn't get to the muscle, but it can decrease the shot pain by about 40%. The other really important thing is to try to be calm yourself, because kids will read off on your
nervousness. You're going to be okay. Everything's going to be fine.
Right?
Yeah.
Super important, but you know, there's other really important factors about going back to school. Those kids who need their sports physical exam, a lot of topics we need there. And then the age group that we often lose touch with are the kids that are going into high school. So important, you know, the preteen, teen years, so many changes happening. Developmental, emotional. It's really a good time to touch base. So.
Yeah, and make sure you're kind of keeping tabs on what's going on there. We got to run. As always, great information. We love having you on here. We love the advice. And there you go. Hopefully this will help you a little bit with those kiddos having to get those shots for back to school. Let's get over to Christine Rapp, back to school forecast.